Usually around surgery, most people who are active are really concerned about losing muscle mass and strength. And certainly, let's appreciate that disuse atrophy, or not using the musculature, or seeing the musculature inhibited or protected or immobilized for long periods of time, is certainly a problem. And even with the best sort of technology and the best activities engaged with high levels of professional therapeutic rehab, we're going to see some loss of muscle mass. But what we also know is that strength is a relatively stable construct. And in 4 to 6 weeks, we actually see that we can maintain a lot of our athletes' strength. And so sometimes focusing on strength is not necessarily where we can get the best bang for the buck. Certainly well-bodied training, as we've talked about before, is an important aspect of every rehabilitative process, that you're staying engaged with your training community and that you're doing your rehab and working on those unreasonable goals in sort of the general training context. So you're training, and then you just happen to having to regress some aspect of your movement or your loading to allow for the tissues to heal. So again, what we know is that there's great carryover from, working on one leg to making the other leg stronger. That training one arm will make the other arm stronger. The body still thinks in these systematic ways. But one of the things that we do see that happens regularly is that people's aerobic fitness and cardiovascular fitness perishes during these rehabilitative times. So we're doing some strength training or some neuromuscular training for the limb or the tissues, but then meanwhile, the rest of the system has decayed. And it's actually quite difficult to rebuild that aerobic engine. So even if you're not an aerobic athlete, I want you to take a moment to say that this is an incredible opportunity to actually leverage the incredible systems of your body to facilitate your healing. First is that we see that athletes who have had surgery and suddenly experience a diminishment in their activity undergo a lot of sleep disruption. So many of us who are athletes or athletic or active self-soothe with a lot of activity. We have high desires to drive, to move, and that's part of our daily programming as a way of making ourselves feel better, even just the habit of doing that. And suddenly, after a surgery, we see that there's a big loss in volume. So one of the things that we're huge fans of is that if we can maintain our non-exercise activity levels, our movement levels, we're actually able to maintain enough loading in the system that it doesn't disrupt our sleep massively. We're seeing that our athletes who are working pretty hard suddenly don't work very hard, and they're not accumulating enough actual fatigue to make sleep happen. So we end up seeing disruption sleep, and then that dysregulates a whole lot of other systems. So first and foremost, we can look at this as non-exercise activity movement. And we really want you to think about being as creative as you can. Once the incision is healed, if you have access to a pool, it's really about trying to get as much movement as you can. If you love the Echo bike or you have a spin bike at home, that is fantastic as well. But even taking 21-minute walks around the island in your house can be enough to sort of move you in the right direction. So some of the surgeries that we're going to talk about here, you're going to be on crutches. The leg can only be dependent for so long, it means dangling before it swells. And so what we're really thinking about is, how do I max out my movement? Our feeling is, if it's appropriate and it's not hip that's disrupted, or you're not having back problems that are keeping you from sitting on a bike, or neck problem, that if you can get on some kind of arm bike like the Rogue Echo bike here, then we can get a lot of just movement in, which is going to do things like improve circulation, raise temperature. Again, we talked about non-exercise activity. And really one of the biggest reasons we want to spend a lot of time in these low threshold movement timing sort of exercises is that we know that zone 2, that big, very aerobic, not high aerobic, but it's easy to have a conversation. I can do all of this work while breathing at an intensity where I can still breathe in and out through my nose, really stimulates a lot of growth in the capillaries, in the vasculature. So all surgeries are going to ultimately disrupt capillary beds. We're going to change sort of some of the vasculature in that area, because it's going to, those associated vascular networks that are bringing blood flow in and oxygen into the tissues have been disrupted through the surgery or through the trauma. And the best way to rebuild those things is through zone 2 work. And if you look at and if you've never heard of these, they're basically cardiac zones or heart rate zones that sort of correspond to different sort of intensity. So what we're saying is that this zone 2 work is very low intensity work. And ultimately, we're trying to max that out. Can we get an hour of simple zone 2 work in on top of the other things that we're doing? So you're gonna have to do your specific rehab with your physical therapist and your rehab provider. You may do your well body training, but we're gonna try to layer this in. And it doesn't have to be all at once. You can get 6 10-minute sessions. If that worked out for you, if you had a half hour in the morning and a half hour in the evening on the other side of work, that would be fine. If you wanted to just throw on a movie and watch something, again, you should be able to easily be able to have a conversation, do nose-only breathing during this time. And what we're trying to do is just let the body know that, hey, we're keeping it intact. That this zone 2 work, again, not only does it allow us to create enough non-exercise activity so that we can actually feel better and not see that disruption, but allows us to really improve circulation and kind of stimulate the regrowth of these vascular networks. Of course, we're also like, oh, we're here. I just did an hour and I feel good. Welcome to some intervals, whether that's Tabata a few times a week, 20 seconds on, 10 seconds off, repeated for 8 to 10 rounds, whether that's a short, medium, and long interval. Hey, I'm gonna work on 30 seconds on, 30 seconds off, 30 seconds on, 90 seconds off, 1 minute on, 1 minute off, or I'm gonna do 2-minute repeats on up. We love that we can throw some really responsible intervals in here, open it up, and get our freak on. But the bottom line is that we are big fans of seeing if can I improve my aerobic conditioning. Again, one of the aspects of having access to a bike like this is it's pretty easy on, easy off with one limb dependent or one limb managed. But one of the things that we're able to do is take some of those rehabilitative exercises or even some simple bodyweight exercises and make them very hard by doing a minute hard or some interval here and then performing that set of exercises. So again, if there is one thing moving forward, hey, I'm worried about keeping my body intact, not gaining a bunch of weight, making sure I can sleep, taking care of the tissues, maintaining your aerobic base or spending time focusing on that nose-only breathing level during those easy blocks can go a long way to enhancing your recovery.